Hi, I'm Dr. Gooi, Consultant General and Colorectal Surgeon at Penang Adventist Hospital. There are various causes of rectal bleeding ranging from benign to malignant condition involving the whole gastrointestinal tract. Common benign causes include hemorrhoids or piles and anal fissure, where there is a tear at the anal verge causing painful rectal bleeding. However, there are also serious life-threatening conditions that can bleed like colorectal cancer. Less frequent causes are colitis due to infection, inflammatory bowel disease, or diverticular disease, which can present as heavy lower GI tract bleeding. First, don't panic. If possible, take a photo in order to show to your doctor later. Next, to estimate the amount of bleeding. It is heavy bleeding associated with large amount of clots. It is an emergency and you need to seek urgent medical help. The color of the blood is crucial to determine the source of the bleeding. Bright red color blood likely arises from anal or rectal region. Maroon or dark color blood indicates the bleeding is from the colon or small bowel. However, if the color is blackish or like tar, then it is likely from upper gastrointestinal tract, for example, bleeding from gastric ulcer. It is also important to differentiate whether the blood is mixed with your stool. If bleeding occurs after bowel movement or after wiping on toilet paper, the bleeding is likely from the anal causes. However, if blood is mixed with feces, then it is likely bleeding from above. If the amount of bleeding is heavy, you should seek urgent medical help. You should also see a doctor as soon as possible if the bleeding is associated with alarming symptoms such as recent change of bowel habit, incomplete sense of bowel evacuation, or unexplained weight loss. Otherwise, if the bleeding persists, especially if you are over 50 years old, then it is advisable to get further checkup as it can be due to serious underlying causes like rectal cancer. Besides thorough history and physical examination, digital rectal examination is very important because many rectal tumors can be felt during digital examination. This will enable the doctor to make a quick diagnosis and to arrange urgent colonoscopy. In clinic, the doctor also can perform proctoscopy by inserting a small device called proctoscope in order to inspect the anorectal region. And the most important diagnostic tool for rectal bleeding is colonoscopy. Apart from making accurate diagnosis, it has therapeutic value as the surgeon can remove benign polyps in the colon to prevent malignant change later. First, patient need to complete bowel preparation and cleaning with laxatives prior to scope. Colonoscopy basically is a high-definition camera attached to a flexible scope introduced via anal canal and to inspect the entire large bowel up until the cecum. Usually, it is done under moderate sedation with proper monitoring, and it is safe, and the process is usually take about 20 to 30 minutes. The treatment is depending on the causes and the severity of bleeding after the initial diagnosis. Vast majority of patients with benign conditions like hemorrhoids and anal fissure can be successfully treated conservatively without surgery. However, if the diagnosis of colorectal cancer is made, then the patient needs to go through tumor staging and surgery later. In general, take balanced diet rich in fiber, maintain a habit of regular bowel movement, avoid prolonged and excessive straining in toilet. Lastly, it is important to check the colon regularly with colonoscopy every 5 years after 50 years old.